Hormones play a crucial role in the functioning of the female body, controlling everything from menstrual cycles to mood swings. When hormone levels are imbalanced, it can lead to a variety of physical and emotional symptoms that can significantly impact a woman's quality of life. Hormonal imbalances in women can be caused by a variety of factors, including menopause, pregnancy, and certain medical conditions. The most common hormonal imbalance in women is estrogen dominance, which occurs when the body produces too much estrogen relative to progesterone. This imbalance can lead to a range of symptoms, including irregular periods, heavy periods, mood swings, breast tenderness, and weight gain. Another common hormonal imbalance in women is hypothyroidism, which occurs when the thyroid gland does not produce enough thyroid hormone. This can lead to fatigue, weight gain, dry skin, hair loss, and depression. Polycystic ovary syndrome, PCOS, is another hormonal disorder that affects women, and is caused by an excess of androgens, male hormones, in the body. PCOS can lead to irregular periods, weight gain, acne, and excess hair growth. Hormonal imbalances can also lead to emotional symptoms, such as anxiety, depression, and irritability. These emotional symptoms can be particularly challenging for women, as they can impact relationships and daily functioning. Treatment for hormonal imbalances in women varies depending on the cause and severity of the imbalance. For women experiencing mild symptoms, lifestyle changes such as regular exercise, stress management, and a healthy diet can be effective in balancing hormones. In more severe cases, hormone replacement therapy, HRT, or other medications may be necessary. Overall, hormonal imbalances in women can be challenging to manage. But with the right treatment and support, women can improve their quality of life and manage their symptoms effectively. It's important for women to speak with their healthcare provider if they suspect they may be experiencing a hormonal imbalance, as early intervention can lead to better outcomes. Menopause is a natural biological process that marks the end of a woman's reproductive years. It typically occurs between the ages of 45 and 55, although it can occur earlier or later. Menopause is a complex process that involves changes in hormone levels, the functioning of the reproductive system, and various physical and emotional symptoms. Symptoms of menopause. Menopause can be accompanied by a variety of physical and emotional symptoms. The most common physical symptoms include hot flashes, night sweats, vaginal dryness, and changes in the menstrual cycle. Emotional symptoms may include mood swings, irritability, anxiety, and depression. Diagnosis of menopause. Menopause is typically diagnosed based on a woman's age and symptoms. A doctor may also perform blood tests to check hormone levels, such as follicle-stimulating hormone, FSH, and estrogen levels. These tests can help confirm whether a woman is going through menopause. Implications of menopause. Menopause can have a significant impact on a woman's overall health and well-being. It can increase the risk of osteoporosis, heart disease, and other health problems. Menopause can also affect a woman's emotional health, causing mood swings, irritability, and depression. Lifestyle measures for menopause. There are several lifestyle measures that women can take to manage the symptoms of menopause. These include eating a healthy diet, getting regular exercise, reducing stress, and getting enough sleep. Eating a diet that is rich in fruits, vegetables, whole grains, and lean protein can help support overall health and reduce the risk of chronic diseases. Management of menopause without HRT. Hormone replacement therapy, HRT, is a common treatment for menopause, but it is not the only option. Women can also manage their symptoms through lifestyle changes, natural remedies, and alternative therapies. Some natural remedies that may help relieve symptoms of menopause include black cohosh, red clover, and soy products. Other alternative therapies such as acupuncture, yoga, and meditation can also help manage symptoms. In conclusion, menopause is a natural biological process that every woman will go through at some point in their life. While menopause can be accompanied by a variety of physical and emotional symptoms, there are several lifestyle measures and alternative therapies that women can use to manage these symptoms without the use of hormone replacement therapy. By taking care of their overall health and well-being, women can transition through menopause with minimal disruption to their daily lives. Gynecological health is a critical aspect of overall well-being for individuals with female reproductive systems. Unfortunately, many misconceptions and misunderstandings surround this topic, leading to confusion, stigma, and potentially harmful decisions. In this video, we will explore some of the most common misconceptions about gynecological health, and provide accurate information to promote awareness and empowerment. Misconception 1. Painful periods are normal. One of the most persistent misconceptions is the belief that excruciating pain during menstruation is a normal part of being a woman. while some discomfort can be expected. Severe pain, known as dysmenorrhea, is not normal. It may indicate underlying gynecological conditions, such as endometriosis, fibroids, or pelvic inflammatory disease. Ignoring such pain can lead to delayed diagnosis and treatment. Women should seek medical advice if they experience severe menstrual pain to rule out any underlying issues. Misconception 2. Contraception equals promiscuity. Another common misconception is the association of contraception with promiscuity. This harmful belief can discourage individuals from using contraception as a means of family planning and protecting their sexual health. Contraception serves various purposes, including regulating menstrual cycles, managing hormonal imbalances, and preventing unintended pregnancies. It is a responsible and personal choice that should not be stigmatized. Misconception 3. Pap smears prevent all gynecological issues. While Pap smears are a crucial tool for detecting cervical cancer, they do not screen for all gynecological issues. Some individuals may assume that a negative Pap smear result means they are entirely free of gynecological health concerns. This misconception can lead to neglect of other important aspects of gynecological health, such as sexually transmitted infections, STIs, uterine or ovarian issues, or breast health. Regular checkups and open communication with healthcare providers are essential for comprehensive gynecological care. Misconception 4. Vaginal odor is always a sign of infection. Another misconception is the belief that any vaginal odor is a sign of infection or poor hygiene. In reality, every person has a unique vaginal odor, which can change throughout the menstrual cycle. Mild fluctuations are normal, but a sudden, strong, or foul-smelling odor may indicate an infection. However, it's essential to recognize that vaginal odor alone does not always signal a problem. If in doubt, it's advisable to consult a healthcare professional, rather than self-diagnosing or resorting to douching, which can disrupt the natural balance of vaginal flora. Misconception 5. Menopause means the end of intimacy. Menopause is often misunderstood as the end of sexual desire and intimacy. While hormonal changes during menopause can affect libido and vaginal dryness, it does not mean the end of a satisfying sexual life. Open communication with a partner and healthcare provider can help address these changes and explore various treatment options, including hormone therapy or non-hormonal remedies. Misconception 6. Birth control methods are always harmful. Some individuals hold the misconception that all birth control methods have harmful side effects, while some methods may come with risks and side effects. These should be weighed against the benefits and individual health factors. Birth control methods have evolved over the years, and there are various options available, with different hormonal and non-hormonal approaches. Consulting a healthcare provider can help individuals choose the most suitable and safe method for their needs. Misconception 7. All gynecological cancers are fatal. The belief that all gynecological cancers are fatal is a misconception that can lead to fear and anxiety. While gynecological cancers can be serious, early detection and advances in medical treatments have improved survival rates significantly. Regular screenings, awareness, and early intervention play critical roles in improving outcomes. It is essential for individuals to know their risk factors and engage in preventive measures, such as vaccinations against HPV, human papillomavirus, which can prevent certain types of cervical cancer. Conclusion: gynecological health is a vital aspect of overall well-being for individuals with female reproductive systems. Dispelling common misconceptions about gynecological health is crucial to ensure that people make informed decisions, seek timely medical care, and prioritize their reproductive and sexual health. Promoting accurate information, open dialogue, and reducing stigma surrounding gynecological health are essential steps towards better overall health outcomes for all individuals. Osteoporosis is a condition characterized by a loss of bone mass and density, leading to weak and brittle bones that are more susceptible to fractures. It is a common condition that affects millions of people worldwide, and it is more prevalent in women than men, especially after menopause. Osteoporosis can lead to significant morbidity and mortality, and it is therefore essential to understand its risk factors, prevention, and management. Risk factors for osteoporosis include advanced age, female gender, family history of the condition, low body weight, smoking, excessive alcohol consumption, sedentary lifestyle, and a diet low in calcium and vitamin D. Other risk factors include medical conditions that affect bone health, such as hyperthyroidism, inflammatory bowel disease, and chronic kidney disease. Medications that can increase the risk of osteoporosis include glucocorticoids, anticonvulsants, and certain cancer treatments. Prevention of osteoporosis involves several strategies, including maintaining a healthy lifestyle and diet, engaging in regular physical activity, and optimizing calcium and vitamin D intake. A diet rich in calcium and vitamin D is crucial for maintaining bone health. Supplements may be necessary for those who are unable to obtain adequate amounts through their diet. Weight-bearing exercises, such as walking, jogging, and weightlifting, can help build and maintain bone mass, while smoking cessation and moderation of alcohol intake can also reduce the risk of osteoporosis. Management of osteoporosis involves several approaches, including pharmacological and non-pharmacological interventions. Non-pharmacological interventions include lifestyle modifications, such as increasing physical activity and optimizing calcium and vitamin D intake. Pharmacological interventions may include bisphosphonates, hormone therapy, and calcitonin, which can help slow down bone loss and reduce the risk of fractures. The choice of treatment depends on several factors, including the severity of the condition, the presence of other medical conditions, and the patient's preference. In conclusion, osteoporosis is a common condition that can lead to significant morbidity and mortality. Understanding the risk factors, prevention, and management of osteoporosis is essential for reducing the burden of this condition. Maintaining a healthy lifestyle, engaging in regular physical activity, optimizing calcium and vitamin D intake. Appropriate pharmacological interventions can help reduce the risk of osteoporosis and improve the quality of life for those affected by this condition. Polycystic ovary syndrome, PCOS, is a common hormonal disorder that affects millions of women worldwide. It is a complex condition that involves a combination of reproductive, metabolic, and hormonal imbalances. PCOS is one of the leading causes of infertility in women and can also lead to various other health issues. Understanding the underlying mechanisms, symptoms, diagnosis, and management of PCOS is essential to provide better care and support to those affected by this condition. PCOS was first described in the mid-20th century by American gynecologists Dr. Irving F. Stein and Dr. Michael L. Leventhal. They observed that some women had enlarged ovaries with multiple small cysts and hormonal irregularities, which led to irregular menstrual cycles and infertility. Initially termed Stein-Leventhal syndrome, it was later renamed polycystic ovary syndrome to better reflect the characteristics of the condition. The exact cause of PCOS remains unclear, but it is believed to have a multifactorial etiology involving genetic, environmental, and lifestyle factors. One of the central issues in PCOS is insulin resistance, where the body's cells do not respond effectively to insulin, leading to elevated insulin levels in the blood. This, in turn, stimulates the ovaries to produce more androgens, male hormones, than usual, which disrupts the normal ovulation process. The hormonal imbalances in PCOS lead to a lack of regular ovulation, causing small follicles to accumulate in the ovaries, forming cysts. High levels of androgens can also lead to hirsutism, excessive hair growth, acne, and male pattern baldness. Furthermore, the hormonal imbalance affects other body systems, leading to various metabolic and cardiovascular complications. The symptoms of PCOS can vary significantly among individuals, making diagnosis challenging. Some of the common signs and symptoms includes irregular or absent menstrual periods, excessive hair growth on the face, chest, back, or abdomen, hirsutism, acne and oily skin, thinning hair or male pattern baldness, weight gain and difficulty losing weight, insulin resistance and prediabetes, diabetes, infertility or difficulty conceiving, mood swings and depression, sleep disturbances, skin darkening in certain areas, acanthosis nigricans, high cholesterol levels, pelvic pain. The diagnosis of PCOS involves a comprehensive evaluation of medical history, physical examination, and laboratory tests. Some of the key criteria for diagnosing PCOS include irregular menstrual cycles, clinical or biochemical signs of hyperandrogenism, hirsutism, acne, high androgen levels, polycystic ovaries seen on ultrasound, multiple small follicles in the ovaries, exclusion of other potential causes of symptoms. If left untreated, PCOS can lead to various complications, including infertility and difficulty conceiving, type 2 diabetes and insulin resistance, metabolic syndrome, cardiovascular disease, heart disease, high blood pressure, dyslipidemia, endometrial cancer, due to unopposed estrogen stimulation of the uterine lining, anxiety and depression due to hormonal and psychosocial factor. While PCOS is a chronic condition that cannot be cured, various treatment options aim to manage the symptoms and reduce the risk of complications. The approach to management may vary based on the individual's specific symptoms and goals. Some common strategies include lifestyle changes, weight management through a balanced diet and regular exercise can improve insulin sensitivity and hormone levels. Medications. Hormonal birth control can regulate menstrual cycles and control androgen levels. Anti-androgen medications can help manage hirsutism and acne. Fertility treatments. For women trying to conceive, fertility medications like clomiphene citrate or assisted reproductive technologies, ART, may be recommended. Insulin-sensitizing drugs metformin is sometimes prescribed to improve insulin sensitivity and may help with ovulation. Management of other health conditions. Managing diabetes, high blood pressure, and cholesterol levels is crucial to reduce the risk of related complications. Psychological support. Dealing with the emotional and psychological effects of PCOS may require counseling or support groups. PCOS continues to be an area of active research. Ongoing studies aim to better understand the underlying causes and find more effective treatments. Conclusion. Polycystic ovary syndrome, PCOS, is a complex hormonal disorder that affects women's reproductive and metabolic health. It involves a combination of factors, including insulin resistance, hormonal imbalances, and genetic predisposition. The symptoms and complications of PCOS can significantly impact a woman's quality of life. But with early diagnosis and appropriate management, many of the challenges associated with PCOS can be addressed effectively. Ongoing research and increased awareness are crucial in supporting individuals with PCOS and improving their overall health and well-being. Premenstrual syndrome, PMS, is a common condition experienced by many women in their reproductive years. It refers to a set of physical, emotional, and behavioral symptoms that occur during the menstrual cycle, typically starting a week or two before the onset of menstruation. While most women experience some degree of discomfort during their menstrual cycle, PMS is characterized by a more severe and disruptive range of symptoms. The exact cause of PMS is not fully understood, but it is believed to be linked to the hormonal fluctuations that occur during the menstrual cycle. Specifically, the rise and fall of estrogen and progesterone levels can cause changes in the brain and body that contribute to the symptoms of PMS. Additionally, other factors such as stress, poor diet, and lack of exercise can exacerbate PMS symptoms. The symptoms of PMS can vary widely from woman to woman, but some of the most common symptoms include mood changes, such as irritability, depression, and anxiety. Physical symptoms, such as bloating, breast tenderness, and headaches. Behavioral changes, such as increased cravings for food and difficulty sleeping. The severity of PMS symptoms can also vary from month to month. Some women may experience symptoms that are severe enough to disrupt their daily activities and quality of life. Fortunately, there are a number of treatment options available for women with PMS. Lifestyle changes such as exercise, a healthy diet, and stress reduction techniques can help to alleviate some of the symptoms of PMS. Additionally, over-the-counter pain relievers and anti-inflammatory medications can be effective for relieving physical symptoms such as cramps and headaches. For women with more severe symptoms, hormonal birth control methods such as the pill or IUD can help to regulate the hormonal fluctuations that contribute to PMS. In some cases, prescription medications such as antidepressants may be prescribed to help manage mood changes and other symptoms of PMS. While PMS can be a difficult and disruptive condition, it is important for women to remember that it is a normal part of the menstrual cycle. By seeking out appropriate treatment options and making lifestyle changes to support overall health and well-being, women with PMS can reduce their symptoms and improve their quality of life. Hormones play a crucial role in women's health, affecting various aspects of their physiological, emotional, and reproductive well-being. These powerful chemical messengers are produced by the endocrine glands and regulate numerous bodily functions. In this video, we will explore the significant roles of hormones in women's health, including menstrual cycle regulation, fertility, pregnancy, menopause, and emotional well-being. Menstrual cycle regulation. Hormones are responsible for regulating the menstrual cycle, which is a monthly series of physiological changes in a woman's body. The key hormones involved in this process are estrogen and progesterone, produced primarily by the ovaries. Estrogen stimulates the growth of the uterine lining, while progesterone maintains the endometrium to support potential pregnancy. Any hormonal imbalances can lead to irregular menstrual cycles, causing problems like amenorrhea, absence of periods, or dysmenorrhea, painful periods. Fertility and reproduction. Hormones play a vital role in women's fertility and reproductive health. Follicle-stimulating hormone, FSH, and luteinizing hormone, LH, are crucial for the development and release of eggs from the ovaries during the menstrual cycle. Additionally, estrogen and progesterone levels influence the quality and thickness of the cervical mucus, making it more receptive to sperm. Any disruption in hormone levels can result in infertility or difficulties in conceiving. Pregnancy. During pregnancy, hormones play a pivotal role in creating an optimal environment for fetal development and ensuring a healthy pregnancy. Human chorionic gonadotropin, HCG, is produced by the placenta and helps maintain the production of estrogen and progesterone, preventing menstruation and supporting the uterine lining. These hormones are essential for the growth of the fetus, regulation of maternal metabolism, and preparation of the body for childbirth. Menopause. Menopause marks the end of a woman's reproductive years and is characterized by the cessation of menstrual periods. This natural transition is primarily caused by the decline in hormone production, particularly estrogen and progesterone. The hormonal fluctuations during perimenopause and menopause can lead to various symptoms, such as hot flashes, mood swings, sleep disturbances, and bone loss. Hormone replacement therapy, HRT, is sometimes used to alleviate these symptoms and reduce the risk of certain health conditions associated with menopause. Emotional well-being. Hormones also influence women's emotional well-being and mental health. Estrogen, progesterone, and other neurotransmitters interact in complex ways, affecting mood, anxiety levels, and cognitive function. Fluctuations in hormone levels during the menstrual cycle, postpartum period, and menopause can contribute to mood disorders, like premenstrual syndrome, PMS, postpartum depression, and perimenopausal mood swings. Conclusion. Hormones play an integral role in women's health throughout their lives. They regulate the menstrual cycle, fertility, pregnancy, menopause, and emotional well-being. Maintaining hormonal balance is crucial for overall health and quality of life. Any disturbances or imbalances can lead to a wide range of health issues, including menstrual irregularities, infertility, pregnancy complications, menopausal symptoms, and mood disorders. A better understanding of hormonal functions and advancements in medical science allow for the development of effective treatments and therapies to optimize women's hormonal health and improve their overall well-being. Women's heart health is a topic that has gained increasing attention over the years. While heart disease is often associated with men, it is the leading cause of death for women worldwide. The statistics are alarming. 1 in 3 women will die of heart disease. And every minute, a woman dies from a heart attack or stroke. However, despite these numbers, women's heart health is often overlooked and underfunded. In this video, we will explore the factors that contribute to heart disease in women, the unique symptoms women experience, and the steps women can take to protect their heart health. One of the primary factors that contribute to heart disease in women is hormonal changes. Estrogen, the female hormone, has a protective effect on the heart. However, during menopause, when estrogen levels decrease, women become more susceptible to heart disease. Other risk factors for heart disease in women include high blood pressure, high cholesterol, diabetes, smoking, and obesity. Women who have a family history of heart disease or have had pregnancy complications, such as preeclampsia, are also at an increased risk. Unlike men, women may experience different symptoms of a heart attack or stroke. While chest pain is the most common symptom, women may also experience shortness of breath, nausea or vomiting, back or jaw pain, and overwhelming fatigue. These symptoms can be subtle and may not be recognized as signs of a heart attack or stroke. As a result, women may delay seeking medical attention, which can lead to delayed treatment and a worse outcome. To protect their heart health, women can take several steps. First and foremost, women should be aware of their risk factors for heart disease and work to manage them. This may include making lifestyle changes, such as eating a heart-healthy diet, exercising regularly, quitting smoking, and managing stress. Women should also have regular checkups with their healthcare provider to monitor their blood pressure, cholesterol, and blood sugar levels. If needed, medication may be prescribed to help manage these conditions. In addition to these steps, women can also take proactive measures to reduce their risk of heart disease. This may include incorporating heart-healthy foods into the diet, such as fruits, vegetables, whole grains, lean proteins, and healthy fats. Women should also aim to get at least 150 minutes of moderate-intensity exercise per week, such as brisk walking, cycling, or swimming. Finally, women should prioritize stress management, whether through meditation, yoga, or other relaxation techniques. In conclusion, women's heart health is a critical issue that requires greater attention and resources. Heart disease is a leading cause of death for women worldwide, and women often experience different symptoms than men. To protect their heart health, women should be aware of their risk factors and take proactive steps to manage them, including making lifestyle changes, seeking medical attention when needed, and incorporating heart-healthy habits into the daily routine. By prioritizing their heart health, women can live longer, healthier lives. Managing women's hormonal imbalance holistically involves addressing various aspects of a woman's life, including nutrition, stress management, physical activity, and potential natural remedies. It's essential to note that individual responses to different approaches may vary, and consulting with a healthcare professional is advised before making significant changes. Here's a holistic approach to managing hormonal imbalance. Nutrition. Balanced diet. Ensure a well-balanced diet with a variety of nutrient-dense foods. Include fruits, vegetables, whole grains, lean proteins, and healthy fats. Phytoestrogens. Incorporate foods rich in phytoestrogens, such as flaxseeds, soy products, and legumes, which may help balance estrogen levels. Omega-3 fatty acids. Include sources of omega-3 fatty acids like fish, chia seeds, and walnuts, as they may help reduce inflammation and support hormonal balance. Stress management. Mind-body techniques. Practice stress-reducing techniques such as yoga, meditation, deep breathing exercises, or progressive muscle relaxation. Adequate sleep. Ensure sufficient and quality sleep, as it plays a crucial role in hormonal regulation. Regular exercise. Aerobic exercise. Engage in regular aerobic exercise, such as walking, jogging, or swimming, to help regulate hormones and improve overall well-being. Strength training. Include strength training exercises to support muscle mass, which can influence hormonal balance. Avoid hormone disruptors. Environmental toxins. Minimize exposure to endocrine-disrupting chemicals found in certain plastics, pesticides, and household products. Personal care products. Choose natural and chemical-free personal care products to reduce exposure to harmful substances. Herbal supplements. Adaptogenic herbs. Consider incorporating adaptogenic herbs like ashwagandha or rhodiola, which may help the body adapt to stress. Vitex, chaste tree. Some women find relief from hormonal imbalances with Vitex, which may help regulate the menstrual cycle. Bioidentical hormones. Consultation with a healthcare professional. Discuss the option of bioidentical hormones with a healthcare provider, as they are designed to mimic the body's natural hormones more closely. Mind-body connection. Counseling or therapy. Emotional well-being is closely tied to hormonal balance. Consider counseling or therapy to address any emotional or psychological factors affecting hormonal health. Regular health checkups. Hormone testing. Periodic hormone testing can provide valuable information about hormonal levels and guide personalized approaches to management. Community support. Supportive networks. Joining support groups or communities can provide emotional support and valuable insights into managing hormonal imbalances. Remember, individual responses vary, and it's crucial to consult with a healthcare professional to create a personalized holistic management plan tailored to your specific needs and health conditions. Thank you for watching this video.